tackling Chapter 4, Opiates, Opioids, and Sedative Hypnotics. Pretty long chapter. Fascinating chapter, however. So let's go ahead and get into it. There you go. That's what's going on. Depressants depress the activity in the central nervous system. That's why they're called depressants. They sedate, they cause muscles to relax, they may depress inhibitions, your emotions, your impulses. They mimic the natural inhibitory neurotransmitters endorphins, enkephalins, and GABA or gamma-aminobutyric acid. Three major classes of downers: opiates, opioids, sedative hypnotics, and alcohol. We'll be tackling alcohol in another chapter. Four minor classes of depressants: skeletal muscle relaxants, antihistamines, over-the-counter depressants, and look-alike depressants. Now, the thing about look-alike depressants is that we don't really have any in the United States. They are illegal, and people don't get enough of a buzz out of them to bring them into the United States. Opiates, opioids, this is just a small sample of the opiates, opioids. Opium, of course, morphine, codeine, hydrocodone, another name is Vicodin, oxycodone, another name is Oxycontin, methadone, and heroin. They're all opiates, opioids, but there are more, and we'll talk about all of them in just a moment. Originally developed as a painkiller and cough suppressant and diarrhea treatment, the opiates, opioids are part of medicine now. Sedative hypnotics are synthetic chemicals developed to treat anxiety and insomnia. Examples would be naproxamate, also known as Miltown, phenobarbital, Seconal, Doridim, methaqualone, which is another name is Quaaludes, flintrazepam, another name is Rohypnol, the date rape drug, GHB, which is also a date rape drug, benzodiazepines, and two best examples are Xanax and Valium. Alcohol is a natural byproduct of the fermentation process of plant sugars or starches. This is the oldest psychoactive substance used by humans, is alcohol. Alcohol is the world's second most destructive drug after tobacco. And of course, as American Indians, you can say, "Oh, you monsters, you brought alcohol to us, and now look what it's doing to us." And of course, we can counter by going, "Oh, you monsters, look what you've done. You've given us tobacco, and it's the most destructive drug in the world." So you got a lot to complain about, and so do the rest of the world, especially the smoking world. Skeletal muscle relaxants. Synthetically, it develops central nervous system depressants that target the area of the brain responsible for muscle coordination and activity. I'm not going to read the chemical names. I'm just going to read the common names. Soma, paraffin forte, Flexeril, Lorasol, and Robaxin. And while I was working in medicine, of course, these were all prevalent. Antihistamines found in cold and allergy medications to block the neurotransmitter histamine. The synthetic drugs are used to treat allergic reactions, to prevent ulcers, to prevent shock, to prevent rashes, to prevent motion sickness, to prevent symptoms of Parkinson's disease. Over-the-counter depressants, sleep aids or sedatives, Nitol, Sleepies, Sominex. Active ingredients are scopolamine, antihistamines, bromide derivatives, and alcohol. And Nitol, Sleepies, and Sominex. Look-alike depressants, as I said, not legal in the United States. They're rarely seen today. If they were, if they had more of an impact on people, then they probably would be out in the drug market someplace. Opiates are products of the opium poppy. Opioids are synthetic versions of the opiates. Opiates come from the milky sap that oozes from the unripe seed pod of the flower. It will ooze for about a week. It can be milked about 6 times in any given season. And there you go. That's what it looks like the opium poppy, oozing the white liquid. Opium produces over 25 alkaloids. The two most important are codeine and morphine. Codeine makes up 0.7% to 2.5% of the opium exudate. Morphine makes up 10 to 20% of the opium exudate. Third alkaloid that is a stimulant rather than a depressant is themane. Semi-synthetic opiates are opiates that are refined in a select way to produce a psychoactive substance that is partially natural and partially synthetic. And that's what heroin is, a semi-synthetic opiate. Hydrocodone, Vicodin, Percodan, and Oxycontin. Hydromorphine, also known as Dilaudid, are semi-synthetic. Fully synthetic opiate drugs are Demerol, Meperidine, propoxyphene, also known as Darvon, and Methadone, the treatment for heroin addiction. Synthetic opioid antagonists, naltrexone and naloxone. So if you have a heroin overdose, if you give them a dosage of naltrexone or naloxone, it will stop the opiates. It will unblock the opiates from the receptor sites. Opium poppies were first cultivated in ancient Mesopotamia. It then spread north to Greece and west to Egypt, eventually making its way east into Asia. Opium was used in many medicines in the Old World, but its ills were seen even then when various writers wrote of its addictive properties. Opium tended to be used as an additive. It was eaten, it was chewed or mixed with liquids and drunk. In the early 1500s, opium regained popularity when the Swiss chemist Paracelsus began making a tincture. Tincture means mixed with alcohol with opium powder, and that was known as laudanum. He used it to treat dysentery, pain, diarrhea, and coughs. Opium continued to be used in medicinal mixtures for the next 3 centuries. Paregoric tincture of opium with camphor was developed from the treatment for the treatment of diarrhea. This mixture is still used today. As a matter of fact, when my mother was sick with gallbladder disease, she had some fairly serious diarrhea, and the doctor gave her paregoric. Opium smoke, that was back in the 50s, so that was a while back. Opium smoking became popular in the 16th century. This means of drug introduction puts more of the active ingredients in the system faster, about 7 to 10 seconds. Because the psychoactive ingredients enter the bloodstream and brain faster, there is a greater sense of euphoria, well-being, and relaxation. Modern methods of smoking heroin involve heating the substance in tinfoil and inhaling the fumes through a straw, and this is known as chasing the dragon. There she goes. She's chasing the dragon. In 1805, the morphine alkaloid was first isolated from opium and was found to be 10 times stronger than opium and thus a more effective painkiller. Morphine was first used in the Crimean War from 1853 to 1856, a war fought between the Russians and the English, and then during the American Civil War. Opium poppies were actually grown in the South to provide morphine for the Confederate troops. In 1832, the weaker alkaloid codeine was isolated from opium. It was found to only be twice as strong as a painkiller as opium. Codeine was used to treat coughs and general neuralgia. When I had my tonsils taken out, they gave me codeine for the pain. As it turns out, I am not sensitive to opiates or opioids. So whenever they try to knock me out with opiates, opioids, it doesn't work. They have to give me a double dose just to put me out. And that includes fentanyl. So The codeine they gave me didn't work. I had to take aspirin, and that worked, and the codeine didn't. I had knee surgery once upon a long time ago, 2005, and they gave me Vicodin, and the Vicodin didn't touch the pain, but I took extra strength Tylenol and took care of the pain. So I can take Tylenol, I can take aspirin. I can't take ibuprofen, but the opiates do not work. In 1874, so how do they knock me out? They give me a double dose of whatever. You know, one dose will knock you out. They have to give me a double dose, and then I wake up during surgery, which is never any fun, I can assure you. In 1874, a British chemist boiled morphine with acetic anhydride to create an opiate synthetic that was 5 to 8 times stronger than morphine. Bayer Pharmaceuticals of Germany bought the chemical and named it heroin. Its effects were heroic on the individual. Bayer marketed it as a cough suppressant, chest painkiller, and a treatment for tuberculosis and pneumonia. Heroin crossed the blood-brain barrier more rapidly than morphine. The result was a more intense and rapid rush and euphoria. It is estimated that at the turn of the 20th century, there were between 250,000 to 1 million morphine and heroin addicts in the United States. Through the 1800s, patent medicines were produced that contained opiates. These patent medicines were used for such problems as tired blood, colicky babies, coughs, diarrhea, and toothaches. They were used to quiet loud children and to aid in sleeping. Surprisingly, surveys showed that more than half of the opium addicts were women, somewhere between 56 and 71% of all heroin addicts or opium addicts were women. Famous opium addicts of the 19th century, Jane Addams, who was the founder of the social work discipline. Famous opiate addicts of the 19th century, Sarah Bernhardt, the famous actress. Elizabeth Barrett Browning, the famous poet. Charlotte Bronte, the famous author. Louisa May Alcott, the famous author. Samuel Coleridge, the poet. Charles Baudelaire, a French poet and writer. Lord Byron, an English poet. John Keats, another English poet. Edgar Allan Poe, an American author. Algernon Swinburne, an English writer. Opium, morphine, and heroin became a health concern in the United States around the turn of the 20th century. In 1906, the Pure Food and Drug Act was passed limiting the manufacture and use of opiates. In 1914, opiates became the first drug considered a narcotic in the Harrison Narcotics Act. By 1924, heroin production was outlawed in the United States. In 1915, only 63 of the people incarcerated in federal prisons were incarcerated for narcotics violations. By 1928, 1 out of every 3 people were incarcerated because of narcotics violations, about 2,529 prisoners. By 2004, 86.5% of the federally incarcerated prisoners had been convicted on drug offenses. That's 155,900 prisoners out of 180,328. Because of the market for opiates in the United States, criminal organizations sprung up to supply the demand. The Chinese triads, the mafia, the French connection, the Mexican narcotraficantes, African traffickers, Russian mafia, and Colombian cartel. All of these people were bringing drugs into the United States. At present, 4.6 million Americans use opiates, opioids illicitly every month. Only 136,000 to 800,000 of these individuals are heroin users. 3.5 million people in the United States have tried heroin. The rest are prescription drug abusers, mostly Oxycodone and Vicodin. A new wrinkle that is appearing in Dallas area junior and high schools is cheese. a mixture of a little Mexican brown heroin and over-the-counter medications containing antihistamines. The mixture gives the individual a rush. Several deaths have caused a nationwide scare. Worldwide, 5 to 10 million people are regular heroin users. The U.S. only consumes about 3% of the heroin produced. The areas that are affected the most are Europe and Asia. 92% of the world's heroin is produced in Afghanistan. Most of the world's legal opium for pharmaceutical purposes is grown in India. Most of the heroin coming into the United States comes from Mexico. Medically, opiates opioids are prescribed to deaden pain, control coughing, stop diarrhea. Non-medically, opiates opioids are used to drown out emotional pain, get a rush, induce euphoria, and prevent withdrawal symptoms. Pain is transmitted to the central nervous system through the neurotransmitter substance P. The P, of course, stands for peptide, not for pain. The more substance P that is released in the synaptic cleft, the greater the pain. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers. And the three endogenous painkillers are endorphins, enkephalins, and dynorphins. The endogenous painkillers occupy the substance P receptors, the opioid receptors, referred to as mu receptors, kappa receptors, delta receptors, and non-opioid sigma receptors. Exogenous opioids, opiates opioids work because they occupy the opioid receptors, acting as if they were endogenous painkillers. Endogenous painkillers are also activated when an individual feels anxious. It decreases anxiety. It produces a sense of detachment. It makes the individual feel drowsy. It deadens the unwanted emotions. These effects occur because of the inhibiting effect of the endogenous and exogenous painkillers effects on the locus ceruleus. And the locus ceruleus is right here in the brainstem. Opiates opioids induce pleasurable feelings by slotting into receptor sites meant for the endogenous painkillers, inhibiting the action of GABA, triggering glutamate receptors, enhancing dopamine neurons in the reward reinforcement pathway, increasing the release and enhancing the effect of dopamine. Heroin has the strongest effect of all the opiates opioids. The reward reinforcement pathway performs two functions. It signals pleasure so that an act is more likely to be repeated. It signals the alleviation of pain. Research has disclosed that relief of pain is a stronger incentive than the introduction of pleasure. With psychoactive drugs, especially opiates opioids, the desire to prevent withdrawal symptoms is a stronger incentive for continued use than the desire for pleasure. When an individual is prescribed opiates opioids, a non-abuser will use the medication until the pain relief threshold is found. An abuser will use beyond the pain relief threshold, searching for an emotional high. Chronic users of opiates opioids will use the drug in excess to prevent the withdrawal symptoms they are seeking to return to the normal state. Opioid-like receptor sites have different functions. Mu and sigma receptors trigger the reward reinforcement pathway. They block pain transmission. They change mood. They cause pupil contraction. They depress the autonomic nervous system, respiration, and blood pressure. Kappa receptors induce dysphoria. They induce endocrine changes. They control pain at the spinal cord level. Opiate opioids suppress coughs by blocking the activation of the cough center in the brainstem. Codeine and hydrocodone-based cough suppressants are still widely used. Robitussin AC and Vicodin syrup. People will abuse these substances for the psychedelic effects. Unfortunately, an overdose of the psychedelic substance dextromethorphan can cause respiratory suppression, nausea, and vomiting. Overdose of cough suppressants is usually in combination with other depressants such as alcohol, benzodiazepines, and antidepressants. Opiates, opioids are also given to control diarrhea. Opiates, opioids work on the brainstem to inhibit gastric secretions and depress the activity of the gastric muscles. Opiate opioids addicts may suffer from severe constipation. Opiate opioids affect every part of the body, but especially the heart, the lungs, the brain, the eyes, the voice box, muscles, cough center, nausea center, reproductive system, excretory system, and the immune system. Well, that just about hits everything, doesn't it? Physical side effects of opiates, opioids, but especially heroin, includes insensitivity to pain, lowered blood pressure, lowered pulse, lowered respiration rate, and confusion. At stronger doses, opiates, opioids, but especially heroin, might cause droopy eyelids, nodding head, slurred, raspy speech, slowed coordination and walking gait, pinpoint pupils, and that's how we used to detect a heroin overdose in the emergency room. We looked for pinpoint pupils. We saw pinpoint pupils, we were pretty sure that this individual had taken too much opiates or opioids. At the time, of course, when I was working in medicine, it was mostly heroin. Histamine release causing itchy, dried skin, suppression of the cough center, hindering the clearance of phlegm, vomiting due to the activation of the nausea center, severe constipation, delayed menstruation, reduced testosterone production in males, dulled sexual desire to the point of indifference. So if we were talking about crack, it would be logical for an individual who is on crack to be a prostitute, to sell themselves for more drugs. But as far as heroin is concerned, it doesn't work. It reduces the testosterone in males, and it dulls the desire to the point of indifference in females. So a crack whore is logical. A heroin whore is illogical, completely illogical. That just cannot happen. She would have a difficult time performing, getting sexually excited, certainly. Tolerance for opiates, opioids occurs when the body tries to neutralize the toxin. It does this by speeding up metabolism, especially in the liver, desensitizing the nerve cells that the substance affects. It increases drug excretion by increasing urine, feces, and sweat output. Alteration of the drug chemistry, brain chemistry to compensate for the effects of the drugs. Opiates, opioid tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. Chronic use of opiates, opioids can cause permanent changes in the brain. Animal studies show that heavy usage of opiates, opioids will reduce the dopamine-producing cells in the ventral tegmental area by 1/4. And the dopamine-producing cells are will produce the dopamine that gives you pleasure. Whoops. Hence, these individuals have less of an ability to feel pleasure or even to feel normal, another reason to take the drug. At this point, the body relies on the drug to feel normal. Withdrawal from opiates, opioids may take place in 3 stages. The acute withdrawal, the body tries to return to normal too quickly. Post-acute withdrawal, subtle emotional and physical symptoms such as mood swings and sleep problems that may persist for 3 to 18 months after use of the drug. Protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. Decrease in blood pressure, decrease in body temperature, decrease in respiration, feeling of general uneasiness. This reaction might be triggered by environmental cues that incite the memories of their addictive life. These cues can persist for decades after cessation of use. And this is one of the reasons why it's difficult for people that are heroin addicts to stay away from the drug, because there's always this pressure, this idea, this feeling that they need to get back into the lifestyle. So if they get anywhere close to somebody who's using the drugs, then the the logical outcome may be that they start using again. Relapses are very common among heroin addicts. Short-acting opiates, opioids, 2 to 3 hours, result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. This is the case with heroin, morphine, and Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. Long-acting opiates, opioids will delay the withdrawal symptoms for 1.5 to 3 days. And this would be methadone and LAAM. LAAM is another treatment for heroin addiction. Peak withdrawal hits at the 4th to 6th day, and recovery may take as long as 2 weeks. Opiates, opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and long term. Codeine, Oxycontin, and Darvon are examples of the in-between drugs. One of the curious withdrawal symptoms of opiates, opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by opiate opioids. All in all, people rarely die from opiate-opioid withdrawals, as they may do with alcohol or sedative hypnotic withdrawals. The results are similar to a severe case of the flu. The problem with opiate-opioid withdrawal is the fear that the withdrawal, since this is the area of the brain that is mostly affected by the drugs. So they have fear, and it's the fear that makes them relapse. Neonatal effects of opiate-opioids usage are extreme because of the drug readily crosses the placental barrier. And as I have told you before, I have a niece, and potentially I'm going to see her this weekend. She's my great niece, I'm sorry. She's my great niece, and she was a heroin addict, and she got pregnant. She continued to take the drugs through her pregnancy, and her baby was born addicted to opioids. It took them 6 weeks to bring him back. He's not completely out of the woods. He has anger issues. He has rage issues, which is a little bizarre. Anything can set him off, and you never know what it's going to be. And he doesn't just get angry, he goes into a rage, and he strikes people, he throws things, and he's getting to the point that he's too big for people to tolerate this, because he's large enough to really do some damage when he starts throwing things. Greater risk of miscarriage, placental separation, premature labor, breech birth, stillbirth, and eclampsia are the problems with opioids. If the fetus survives these dangers, it will be just as addicted at birth as the mother is, though due to size and dilution factors, the withdrawal symptoms are far more severe. That's why it took 6 weeks to cure this child. They tend to have low birth weight. This baby was born at 4.5 pounds. A high-pitched cry, which sounds like a cat screaming. Irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, hiccuping. When they got him off of the heroin, he still only weighed about 4.5 pounds. He hadn't gained any weight at all, and that was mostly because of the diarrhea. In the early 21st century, 4,000 to 5,000 people died from opioids overdoses every year. Last year, 130 people died from opioid overdoses every day. 47,450. This is because of the Vicodin and hydrocodone problems. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. In one study, only 57% of the opioids were accidental. In other words, they took more drugs than they needed to on purpose. Were they trying to commit suicide? They were trying to gain that euphoria, is what they were trying to do. So they just kept taking the drugs. What opiates, opioids, overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate blood. Because of the heart isn't beating, the lungs fill up with fluid resembling drowning. The lips turn blue as the hue begins to imbue the entire body. The pupils become pinpoint. Respiration begins to rasp and rattle. They go into convulsions as much from the lack of oxygen as from the toxins in their system. Excuse me. Death by overdose is one way to die from opiates, opioids. Another is to contract a disease from sharing needles. According to the research, 50 to 90% of IV heroin users carry the hepatitis C virus. A look at individuals who have only shot up for a year shows a rate of 71.4% hepatitis C infection. 20 to 40% of these infected will develop liver disease. 4 to 16% will develop liver cancer. Now we have a treatment for hepatitis C. It's relatively new. It's only a couple of years old, but now we can treat hepatitis C. So the figures aren't quite this bleak. 50% of all IV drug users are HIV positive. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are male. 7 to 10% of the HIV/AIDS cases in the United States were transmitted through sexual contact with heterosexual or homosexual IV drug users. 70% of the children with HIV had mothers who were IV drug users or the sexual partners of individuals who were IV drug users. IV drug abusers will do just about anything to get their fix. Heroin fairly quickly scleroses the veins being used for injection, so the individual has to go to more and more difficult sites for their fix. Their wrist, between the toes, the neck, even the dorsal vein in the top of their penis if they are a male. Heroin users may inject themselves 6 times a day, and sanitation is rarely the top priority. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. Because the individual is immunocompromised by the drugs being used, the severity of the infections are sometimes catastrophic. Staph aureus and beta strep group A are very common in heroin users. And that's what it looks like. It eats your body away. There are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is a condition where a virulent bacteria gets under the skin and eats tissue away. Endocarditis, bacterial infection of the heart valves. Cotton fever, short-term bacterial infections that can cause lots and lots of damage. That's necrotizing fasciitis. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start at different ages. The mean age of first alcohol usage is 16.4. The mean age of first tobacco usage is 17.3. The mean age of first marijuana usage is 17.4. The mean age of first heroin usage is 22.2. From first usage to daily habit averages, about 1 year of sporadic usage. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half were dead, 50 to 100 times greater than the general population. They were dead from overdose, accidental poisoning, homicide, suicide, accident, and liver disease. Half of them were dead. 44% still used heroin. 67% used tobacco, 22% were daily alcohol users, 35.5% used marijuana, 19.4% used cocaine, 10.3% used crack, 11.6% used amphetamines. The group reported high rates of mental health and health problems. The group that now averaged 57.4 years reported frequent interactions with the criminal justice system. There's a shock for you. Morphine is metabolized by the liver. 3 to 6 times the morphine must be ingested to get the same effect as an individual gets from an injection. Morphine will be detectable in the urine for several days after ingestion. 1 out of every 6 Americans has a chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain issues. In one research of chronic pain sufferers, 72% had suffered for more than 3 years and 34% suffered more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because fear of tissue dependence and addiction, fear that the painkiller might mask more serious diseases, fear that they might be thought of as a drug seeker trying to supply a habit. I've been an athlete all my life, and sometimes I get aches and pains. When I do get aches and pains, I never take a painkiller before I exercise again. The reason is because I don't want the painkiller to mask another injury. So I never take any painkillers before I exercise. Risk factors in morphine addiction includes kidney and liver problems, drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug. And when it is mixed with another drug for pain control, it is a Schedule III drug. Codeine was the most widely prescribed and abused opiate in the United States. Its #1 ranking has since been taken over by Vicodin, hydrocodone. Congratulations, Vicodin. Pimp C and DC Screw, dead from cough syrup overdoses. They are 2 rappers, and they are no longer alive. Hydrocodone is also known as Vicodin, Hycodan, Tucin, and Norco. This is a Schedule III drug. The higher the number, the stronger the drug. 120 million prescriptions were written for Vicodin in 2006. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 60 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. Methadone, Darvon, and Demerol were developed in German laboratories during World War II when the Axis powers were cut off from their supply of opium to provide painkillers of similar caliber to morphine. Methadone is less powerful than morphine and lasts longer in the individual's system. Methadone is authorized in the United States as a treatment for heroin addiction. There are 1,292 methadone treatment programs in the United States with 228,000 heroin addicts. Hydromorphone is refined from morphine and gram for gram is 7 to 10 times more potent than morphine. Another name for it, of course, is Dilaudid. Because of its potency, hydromorphone is stringently controlled, and this is the drug that is usually abused by medical personnel if they're going to abuse any opioids. Oxycodone is a semi-synthetic derivative of codeine and is used for moderate to severe pain. Another name for oxycodone is Percodan and OxyContin. This drug is supposed to be taken orally. The effects begin after about 30 minutes. The effects last for 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine and Dilaudid. This drug can be abused by chewing or crushing and injecting or sniffing the resulting drug. The manufacturer of the drug has tried controlling abuse by reducing the strength of the tablets. Demerol has been around longer than most of the synthetics and semi-synthetics. It is 1/6 the strength of morphine, but is widely used as an injectable anesthetic. In large doses, Demerol can cause sedation and euphoria, which makes it ideal for surgery because it doesn't suppress coughing or have the side effect of constipation. It is Demerol that they inject into the spinal column of women when they give a spinal block. This drug is the most widely abused by medical professionals. Demerol, I'm sorry, I said it was Dilaudid. Dilaudid is too strong. Demerol is more widely used. Tolwyn is a weak opioid antagonist as well as an agonist. When used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, the opioid antagonist, to reduce its use as an opioid accelerant. This drug is rarely used now to get a high. Propoxyphene is also called Darvon, Darvocet, Propocet, and Wygesic. It is used for mild to moderate pain relief. This drug metabolizes slowly and so can lead to overdose or addiction if not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Only 4% of overdose deaths using opioids have been seen with propoxyphene. Fentanyl was the most powerful of the opioids as it is 50 to 100 times stronger than morphine. It is used pre- and post-surgery to alleviate excessive pain. It also now comes in a patch for chronic severe pain and in a lollipop. There is also an oral transmucosal tablet called Actic, meant to be dissolved in the mouth. Street chemists have been able to replicate the structure of fentanyl with a powerful drug called China White. Unfortunately, some of the street drug contains MPTP, which kills the dopamine producing cells in the brain, resulting in Parkinson's disease at best, and at worst, a frozen addict who can't move for the rest of their lives. Fentanyl overdose death. Prince died of a fentanyl overdose death. Tom Petty died of a fentanyl overdose death. He had 3 different types of fentanyl in his system when he died. Michelle McNamara died of a fentanyl overdose. She was married to, I can't think of his name, Paxton. No, I can't think of his name. As if fentanyl wasn't killing off enough people, the Food and Drug Administration has approved Suvia, which is 10 times stronger than fentanyl and 1,000 times stronger than morphine. The drug is so strong that coming in contact with its dust from manufacturer can cause an instant overdose. Suvia. LAAM is a long-acting opioid that is used for heroin replacement therapy. LAAM lasts for 2 to 3 days, whereas methadone lasts for only 1 to 2 days. Because it only has to be taken every 3rd day, take-home doses are unnecessary, as is the case with methadone. LAAM metabolizes in the system too slowly for the drug to be used for pain management. LAAM is more tightly controlled than methadone, and despite its success in treating heroin addicts, the paperwork involved makes it an unattractive alternative than the more widely used methadone. Naloxone and naltrexone are opioid antagonists blocking all the exogenous and endogenous opioids. These drugs can be given to people who have overdosed on opioids, blocking the deadly effects of the opioid structure. Unfortunately, naloxone is short-acting and has to be frequently administered to block the deadly effects of the opioid chemical. Naloxone blocks the effect of opioid for up to 72 hours and helps prevent relapse. Buprenorphine is a powerful opioid agonist at low doses, but at high doses becomes an opioid antagonist. At low doses, it is used as an analgesic substitute for morphine. It is 50 times stronger than heroin. At high doses, it has an inverse antagonistic effect and will block opioids from receptor sites for up to 30 hours. At high doses, it can be used as part of an opioid treatment regimen because it blocks the effect of the opioids while taking the edge from some of the side effects. Clonidine or Catapress is often used to diminish nausea, anxiety, and diarrhea. from opioid withdrawal symptoms. It also reduces opioid craving. It reduces the overactivity of norepinephrine receptors, and can cut withdrawal times in half. Used in conjunction with naltrexone, clonidine can reduce withdrawal recovery from 1 month to 5 days. Butorphanol and tramadol, these new synthetic opioids are developed as less abusable or addictive analgesics. These drugs are still abused and have been classified as a Schedule 4 drug. So, whoops. Sedative hypnotics are any drug that relaxes and soothes the body and the mind, sedatives, or eases anxiety or induces sleep, hypnotics. The two main categories are benzodiazepines and barbiturates. Benzodiazepines include alprazolam or Xanax and clonazepam or Klonopin. An example of barbiturates is phenobarbital. There's secabarbital. There's a bunch of barbitals. And we'll talk about them in just a second. Just under half of all prescriptions for psychiatric medications are written for antidepressants. The first sedatives were bromides, also used as anticonvulsants in the 1850s for people with epilepsy. The biggest problem with these drugs was the fact that they had a long half-life, so toxic levels could build up in the body fairly readily. Around the American Civil War, chloral hydrate started being used as a sleep aid and a sedative. It was used to treat tension, pain, insomnia caused by alcoholism, pregnancy neurosis. It was used as the original Mickey Finn to knock out men so that they could be shanghaied and put on a boat headed out to sea. So by the time they woke up, they were out to sea and there's nothing they could do about it. And that's what being shanghaied is. Mickey Finn was what they knocked them out with. And it knocked them out for a number of hours until they could throw them on the boat and take off. In 1882, physicians began using paraldehyde to control alcohol withdrawal symptoms. It is still sometimes used to treat alcohol withdrawal symptoms despite addictive properties and an unpleasant odor. Yuck. It really stinks. Barbiturates were first developed at the end of the 19th century, and their popularity peaked in the 1930s and 1940s. Barbiturates are any compound synthesized from barbituric acid, phenobarbital, secabarbital, and phenobarbital. These substances are highly addictive and fairly toxic, making them fairly dangerous. Miltown or meprobamate was used fairly extensively as a sedative in the late 1940s into the 1950s. It became popular with housewives and came to be known as Mother's Little Helper. Less dangerous than barbiturates, it maintained its popularity until the 1960s when benzodiazepines were developed. There is a song by the Rolling Stones, Mother's Little Helper. You can listen to it if you like, and they're talking about Miltown is what they're talking about. Dorodan was also used as a barbiturate substitute. Unfortunately, it was weaker than phenobarbital. It was just as addictive as barbiturates. It is no longer manufactured in the United States. Librium, chlordiazepoxide, was the first benzodiazepine developed in 1954. Along with diazepam, Valium, these two drugs dominated the sedative hypnotic market until the invention of Prozac. Thought to be a good alternative to the highly addictive barbiturates, benzodiazepines proved to be very addictive themselves, with just as dangerous withdrawal symptoms as barbiturates. Today, there are several new drugs that are being advertised as less addictive. Lunesta, Buspar, Rosarim, Ambien, Lyrica. Only Buspar and Rosarim have proven to be less addictive. Sedative hypnotics proved to be so addictive that their use waxed and waned over the years. At this point in time, benzodiazepines are used sparingly, and they have been replaced by psychiatric medications that are less addictive, and there is a lower possibility of adding them to other medications to get a high. However, sedative hypnotics can still be abused if the drug is overused when prescribed by a physician. It is used in combination with other psychoactive substances for the synergistic or counteractive effect. The drugs are borrowed or stolen from someone as a form of self-medication. The drugs are obtained by other illegal means, for example, forged prescription or buying on the black market. The list of celebrities who have died from barbiturate overdoses is long. Marilyn Monroe had high doses of Nimbutal and Chloral Hydrate in her system when she died. Dorothy Dandridge had high levels of tricyclic antidepressant imipramine, also known as Tofranil, when she was found. Jimi Hendrix was a notorious mixer of drugs. Hendrix had high levels of sacubitril in his system when he asphyxiated on his own vomit. The drugs were prescribed to his girlfriend, not to him. Bruce Lee, the quintessential martial arts expert, died from an allergic reaction to a painkiller containing aspirin and meprobamate. Freddie Prinze shot himself while under the influence of Quaaludes. Prince was the star of the hit sitcom Chico and the Man, and he had Quaaludes in his system when he died. Elvis Presley was a notorious prescription pill mixer. When he died, he had 14 different drugs in his system, including codeine, Quaaludes, and methaqualone. Keith Moon was a drummer for The Who and an alcoholic when he tried to clean up. The drug he was using was the sedative clomethazole. He had 10 times the daily dosage in his system when he died, so he was using it to get high. Abby Hoffman was a 60s anti-war activist. Hoffman was found with 150 tabs of phenobarbital in his stomach. His death was ruled a suicide. Steve Clark was a lead guitarist for Def Leppard. Clark was found by his girlfriend with respiratory failure from a use of painkillers, Valium, antidepressants, and alcohol. Margo Hemingway was an actress and the granddaughter of the iconic author Ernest Hemingway. Granddaughter Hemingway was found dead from an overdose of phenobarbital on the 35th anniversary of her grandfather's suicide. Rob Pilatus of Milli Vanilli, died of a heart attack induced by a sedative given to him to help it with alcohol withdrawals. He was taking the drug with alcohol. Dana Plato, the actress from the sitcom Different Strokes, died from a mixture of Soma, which is a muscle relaxant, and Vicodin. Plato had a long history of prescription drug abuse. Old Dirty Bastard, the lightning rod of the rapper band Wu-Tang Clan, died after mixing tramadol, which is a painkiller, with cocaine. Chris Penn, an actor and brother of Sean Penn, died from a mixture of promethazine, which is an antihistamine, and codeine. The combination mixed with obesity created a fatal enlargement of his heart, and it killed him. R&B singer Gerald Levert died from a combination of Percocet, Vicodin, Darvocet, Xanax, and 2 antihistamines. Anna Nicole Smith, the blousy blonde and playboy bunny from Texas who shocked the world by marrying a one-foot-in-the-grave billionaire, died with 11 drugs in her system, including Ativan, Cyrax, Klonopin, Chloral Hydrate, Lexapro, Valium, Noctec, and Zoloft. Posthumous Academy Award winner Heath Ledger died with 6 drugs in his system: Oxycodone, Hydrocodone, Xanax, Valium, Doxalamine, and Temazepam. Michael Jackson had a number of drugs in his system when he died, but the combination that killed him were propofol, lorazepam, midazolam, and Valium. Officially, Corey Haim died of pneumonia, but the actor had been fighting drug addiction most of his adult life. He was found unresponsive with lethal doses of Valium, Vicodin, soma, and haloperidol in his system. Amy Winehouse was a notorious drug experimenter who went through rehab several times before her death at 27. She had started several episodes of binge drinking and then abstaining before her death. She died of alcohol poisoning with a ethanol level of 0.416. 0.08 is legal. Illegal driving. That is considered drunk. She had 0.416, 5 times as much alcohol in her system as was legal. Of course, she was in England when she died, so. Whitney Houston had been a notorious drug mixer most of her adult life. She was found drowned in her bathtub with high levels of cocaine, Flexeril, Benadryl, Xanax, and marijuana in her system, as did her daughter. Judy Garland had been a child star and had started a pattern of excessive workdays fueled by uppers and downers. At 47, she died of a secabarbital overdose. Philip Seymour Hoffman was a highly touted actor nominated for 4 Academy Awards, of which he won 1. He died at 46 from an overdose of heroin, cocaine, amphetamines, and benzodiazepines. Tom Petty was a rocker for 4 decades. He died at 66 with three forms of fentanyl in his system, along with oxycodone and 3 types of benzodiazepines. Kurt Cobain was the iconic frontman for the alternative rock band Nirvana. While Cobain died of a shotgun blast, he had excessive amounts of heroin and Valium in his system when he died at 27. Who else died at 27? Jimi Hendrix died at 27 as well. Jim Morrison was the lead singer for the San Francisco band The Doors. Morrison considered himself a poet and philosopher as well as a singer. Morrison died of a heroin overdose in his bathtub at age 27. Janice Joplin was a rock star from the late 60s and early 70s. She partied with such iconic figures as the Grateful Dead and Country Joe and the Fish. She died at 27 of a heroin overdose. Prince was a singer and songwriter from 1980 until his death in 2016. His album Purple Rain is one of the most celebrated albums of the last 50 years. He died of a fentanyl overdose at 57. John Belushi was one of the major original players on Saturday Night Live. He played Joliet Jake Blues of the Blues Brothers. In 1982, Belushi overdosed on a speedball at 33. River Phoenix was a child actor from the late 80s who was headed for success. The star of Stand By Me, Indiana Jones and the Last Crusade, and Sneakers, he died of a speedball overdose outside a club in Los Angeles at age 23. Chris Farley was a comedian of Saturday Night Live fame. He starred in such movies as Tommy Boy and Beverly Hills Ninja. He died of a speedball overdose at 33, like his hero, John Belushi. At present, benzodiazepines are the most widely used sedative hypnotics in the United States. Benzodiazepines vary in their half-lives and can cause tissue dependence. For this reason, they can be highly addictive with severe withdrawal symptoms. Most of the physicians only use benzodiazepines as short-term fixes for specific conditions. In order of usage, the most widely prescribed benzodiazepines are alprazolam, or Xanax, 34 million prescriptions, lorazepam, Ativan, 19 million prescriptions, clondiazepam, Klonopin, 16.7 million prescriptions, diazepam, Valium, 12 million prescriptions, temazepam, Restoril, 7.6 million prescriptions. Benzodiazepines are used to reduce symptoms of anxiety and panic disorders, reduce anxiety and apprehension in surgical patients, treat sleeping problems, control skeletal muscle spasms, control seizures, dampen acute alcohol withdrawal symptoms. Side effects of benzodiazepine usage is very similar to alcohol. Benzodiazepines are most often abused in conjunction with other drugs, as they are used to lessen the effects of withdrawal symptoms. methamphetamines, cocaine, and heroin. In one study, 100% of benzodiazepine addicts were addicted to other substances as well. The typical benzodiazepine user is a white, well-educated, 30-plus female. Benzodiazepines work because they increase the effects of the inhibiting neurotransmitter GABA in the cerebellum, cerebral cortex, and limbic system. The stronger influence of GABA inhibits anxiety-producing thoughts and overstimulation of neural messages. Benzodiazepines are metabolized by the liver to produce more powerful metabolites. The original drug and the metabolites tend to stay in the body for an extended period of time because they are extremely fat soluble. Alprazolam or Xanax is used for generalized anxiety disorder, panic disorder, and depression. Triazolam, Halcyon, is used for short-term treatment of insomnia, 7 to 10 days. Diazepam Valium is used for anxiety, skeletal muscle spasms, control of seizures. IV Valium is used as a sedative before surgery. Tolerance has to do with liver efficiency. Older individuals will have a stronger reaction than a younger person. Overdose of benzodiazepines can cause dementia-like symptoms in the elderly. Tissue dependence can occur with excessive use over several months or normal dosage over a year. Because of the drug's lipophilic properties, fat-soluble, even small doses over time can cause tissue dependence and addiction. Withdrawal from benzodiazepines can be severe and take several months to taper off from the drug. Symptoms include recurrence of original symptoms, magnification of symptoms, exaggeration of the recurrence of symptoms, true withdrawal caused by low GABA and excess epinephrine and norepinephrine. Onset of withdrawal begins after 1 day with short-term benzodiazepines and lasts for 7 to 20 days. For long-acting benzodiazepines, withdrawal begins after 5 days and takes up to 28 days for the symptoms to subside. Rohypnol is a benzodiazepine that causes short-term memory loss and sedation. The drug has been used for short-term memory impairment and has been used as a date rape drug since the 1970s. Rohypnol has been banned in the United States along with GHBA since 1996 because of its use as a date rape drug. Buspar is commonly prescribed as an anxiolytic and in combination with an SSRI to treat depression. Buspar does not increase GABA. This drug does not seem to cause addiction and is rarely abused. This drug cannot be used to treat seizures. Lunesta is a hypnotic drug prescribed for insomnia. The drug increases GABA production, leading to relaxation. This substance is only addictive when taken with another drug, Lunesta. Ethylchlorovinol is actually a chemical ether. Chloral Hydrate is actually 3 molecules of ethyl alcohol fused together. 3 molecules of the stuff that makes you drunk. Both these drugs are prescribed to induce sleep and have a long history of addictive use and toxic overdose. And of course, it was chloral hydrate that was in the system of Marilyn Monroe. Remember, chloral hydrate was the Mickey Finn. Knocks you out, keeps you asleep. GHB is a rapid sleep inducer. GHB increases the body's level of growth hormone, HGH. It affects our sedation, disinhibition, empathy, sensory enhancement, and euphoria. Its effects last for 3 to 6 hours. These drugs are metabolized into, GBL and BD are metabolized into GHB. These two substances have been formulated into mint-flavored rave elixirs. Blue Nitro, Revivrant, Gamma G, Rimforce, and Insom X. Those are the names. Quaaludes effects are similar to those caused by alcohol and linger for 60 to 90 minutes. The sedating effect lasts 6 to 10 hours. This is a drug that is often abused in South Africa. Quaaludes. This drug is used, Lyrica is a drug used to treat nerve pain from shingles or diabetes and can be part of seizure treatment. More recently, it has been used for treatment of anxiety, sleep, and mood disorders. This substance is rarely abused alone. Rosarim activates melatonin receptors in the brain. Melatonin is a substance that helps maintain the circadian rhythm. Used for short-term treatment only. When taken with alcohol, the result can be toxic. Zalpalon, Zopiclone, and Zolpidem these are the three Z hypnotics. These drugs are short-acting drugs with 1 to 4 hour half-lives. Excess use causes nausea, headaches, diarrhea, and drowsiness. These drugs are rarely abused except with other drugs. And that is the end of the lecture. So I'll see you guys in a couple weeks. We're probably, I think. I don't know. I haven't really looked at the schedule. Anyway, have a good 6th week.